Well, I think first I'd want to know what your history is and how old you are, because the pregnancy rates are really determined by the age of the egg. So we'd first go over your own personal history, medical history, and if you have any medical issues that would compromise your egg number or quality. We would also go over your past surgical history and any medications that you're on that could potentially affect your egg quality and the number of eggs that would be retrieving.
The absence of a partner or a life partner that they wouldn't want to spend their life with. That's one of the main reasons, and they're not sure when that partner will ever be located. Other women who are concerned about their career, the career advancement, or their education.
The ideal candidate is a woman in her 20s or early 30s who just isn't ready to get pregnant now. And they want to preserve their fertility either because they're doing advanced degrees or they're working or they're just not ready to have a family right now. So a woman who's healthy and has really no other fertility issues, they're the ideal candidate. There's very little data on live birth in women over the age of 40 who are freezing their eggs, but I have to tell you there are lots of women who are over 40 who want to preserve their fertility by freezing eggs because they haven't met their life partner. But we do discuss that because pregnancy rates are based on the age of the egg, when you're under the age of 35, 50% of your eggs are chromosomally abnormal, but when you're over 40, they're much higher. And so that's why the pregnancy rates are lower and the miscarriage rates are much higher.
So as with any procedure involving in vitro fertilization or egg harvesting, this does require preparation. It does require stimulating the ovaries with powerful hormonal medications, which do have an impact on the development of the eggs, but also enlargement of the ovaries. There are definite side effects, which again should be made clear from the beginning so the patient is not alarmed.
So the average cost varies quite a bit, and the reason it varies is the fertility medications are expensive. And so based on your evaluation and how much medication you require, your fertility treatment will vary quite a bit. It can vary anywhere from closer to 8 to 10,000 to 15,000.
Okay.
And then there's an annual storage fee.
I think it's quite a generous offer from those companies. I don't believe they are requiring or mandating that anyone be forced to freeze their oocytes, so I think it's a wonderful elective procedure that women have, and I think women and men should always be given the same opportunity to preserve their fertility.
So it's really based on the age, and typically the success rate can range as long as there's no difference. The survival of the eggs typically will range between 90 to 99%. The sperm fertilization rate depends on the quality of the sperm. So if we're saying that there's no sperm issue, fertilization of those eggs that survived is typically about 80%. And when you grow them out, if they have a good number, then we would say that the pregnancy rate is closer to 50%.
Approximately 50% of the patients who used frozen eggs to help achieve their pregnancy had a live birth, and I'm happy to report that the health of those children has been followed carefully by our program, and we are happy to report that there has been no increase in the incidence of birth defects, either major or minor birth defects, which is very reassuring to us.
When you're actually starting the injections, typically the injections, most women will do shots for about 8 to 10 days, and their egg retrieval is 2 days later, so it's a really 2-week period.